Movie Split by Maddie Wilson and Jenny Kim.
Movie description. 2016 film directed by M. Night Shyamalan. The film takes place in Philadelphia, Pennsylvania. Kevin Wendell Crumb, the main character, lives isolated underneath the Philadelphia Zoo. The plot of the movie involves Kevin kidnapping 3 teenage girls and taking them back to his living area where he torments them with his multiple personalities and his overall belligerent 24th personality, known as the Beast. Kevin is known for having a very hard time socializing, and as a result, he copes by switching between his personalities. Main characters. Kevin Wendell Crumb, a young man diagnosed with dissociative identity disorder. He has 24 personalities that he transitions through to compensate for the abuse he suffered through as a child. Casey Cook, one of the teenage girls kidnapped by Kevin. Out of the 3, she is the only one that has the courage to socialize with Kevin and his personalities. She also has a history of possible psychological disorder, as she has a history of trauma, including self-harm. Lastly, Karen Fletcher, another main character, is Kevin's psychologist who tries to help Kevin become a functioning member of society and control his personalities. Dissociative identity disorder is formally known as multiple personality disorder. It includes switching between personalities or alternate identities. Common symptoms include self-harm, difficulty socializing, suicidal thoughts and behavior, etc. People usually exhibit 2 or more identities that are distinct from one another. Many diagnosed with DID reported childhood trauma or traumatic past. Cultural context. There's a long history of society believing the symptoms of DID are fake or used to avoid legal ramifications of illegal behavior. Communication across cultures and society proves to be difficult when referring to the diagnosis and identification processes of DID. DID is referred to as different things in various cultures. For example, it is called dissociative self-representation, and there are other idioms besides DID that can be used to describe the psychological disorder. This communication across culture proves to cause error and confusion and in the end hurts the patient. Across cultures, DID is also diagnosed and treated differently, which will vary the results and success of said treatments. Every case is different, however, subpar treatment can only hurt the patients more. Treatment in the movie. Dr. Fletcher uses a non-medicated form of psychotherapy known as cognitive behavioral therapy. Using this, she discusses how Kevin can be a functioning member of society and provides good ways to help him control his emotions and personality. She uses his emotions and behaviors to point out right and wrong along with subjective conversation to compensate for his unstable mental awareness. In the movie, Dr. Fletcher realizes that instead of talking to Barry, who is Kevin's dominant and level-headed personality, she's talking to Dennis. Dennis was impersonating Barry to make it seem like he was functioning normally. Dr. Fletcher confronted Dennis directly and tried to help him understand the gravity of his actions. She also tried to use his emotions to persuade him to control his actions and other personalities.
Evidence in movie. 2 symptoms of DID include amnesia, or gaps in recalling everyday events, and having multiple personality disorders take turns controlling behavior. A specific scene where both amnesia and multiple personalities is shown is when Kevin comes into the spotlight. He is triggered to come out when he hears his full name. Kevin has no recollection of what happened and asks what the date is. Once he finds out what he's done, he tells Casey, a girl he kidnapped, to kill him. That is when his other personalities jump in and say he does not know what he's talking about. One symptom Kevin does not show is suicidal tendencies. Some people with dissociative disorders find themselves inflicting self-harm. In Split, however, for horror purposes, Kevin is depicted as a violent kidnapper. Kevin is shown killing/harming others when he is the Beast, but experts say that people with DID are more likely to hurt themselves than others. Proposed treatment. Integrative therapy is a form of progressive psychotherapy and an appropriate plan for Mr. Kevin because it uses methods that best suits you according to your needs/personality traits. I believe Kevin needs a form of therapy that will tailor to his unique case and allow him to overcome his self-destructing behaviors. Integrative therapy uses the combination of medication and psychotherapy to target the metabolic and biological issues present and the emotional and behavioral issues caused by, in our case, Kevin's alternate personalities. Although in the movie the therapist is killed, she still died trying to help him change his ways with new ideas of thinking. Barriers to treatment. Cultural. DID is extremely under-researched and misunderstood. There's not enough treatment outcome studies to find the best type of treatment. DID is extremely under-researched because of how difficult it is to assess the different modes of dissociative self-representation. Situational. Because of the lengthiness and complexity of the treatment process, more tools are needed to see the changes in alternate identities. Another barrier includes how expensive the treatment for patients with DID is, and the lack of funding for long term treatment. Because DID shows limited responsiveness to existing medication, many researchers focus on other disorders that respond better to pharmacotherapy and short term treatments. Societal. DID being associated with childhood relational trauma causes societal barriers. How, you may ask? Well, victims in this situation, being children, go against societal norms, which is that adults should protect the young. There may be discomfort in studying DID because of the abuse of adult power over children. By avoiding studies of DID, they protect social institutions while ignoring the children who are violated. This allows researchers and the public to look the other way and not have to confront the uncomfortable occurrence of abuse. Broader perspectives. Accuracy of portrayal. While some parts may be accurate, like Kevin not remembering when his other identities take control, and the confirmation of trauma being a potential reason of this real mental illness, many of Kevin's identities were over exaggerated to build up suspense and horror. This may cause misrepresentation about all patients with DID being violent. Influence of society's understanding based on portrayal in films. Split tries to validate and recognize the controversy surrounding DID. Dr. Karen Fletcher, Kevin's therapist, helps to do this. She deals with opposition in the film from the field and government, which is shown when she talks about her previous patient being incarcerated instead of being given proper continued treatment. This part really shines a light on how little is known about DID and the need for more research to help those suffering with DID.
The end.